polyhydroxyalkanoates are natural polymers of bacterial origin, and I've been working with them for the last 22 years, so a long time. And with respect to cardiac tissue engineering, I have used them for making what is called a cardiac patch. Post myocardial infarction, what happens is a patient develops scar tissue on the heart, which is not contractile. It doesn't do the contraction and pumping of the blood as normal cardiac tissue would. So the patient then develops basically a heart which is not as functional as it should be. So what we are trying to do is make patches with polyhydroxyalkanoates, seed them with cardiomyocytes, which are derived from induced pluripotent stem cells, which can be derived from a patient, for example, and then replace. So you patch the heart and then you replace that scar tissue with healthy cardiac tissue. And that hopefully then leads to a complete functional heart, and the patient becomes healthy, doesn't need a transplantation or any, drugs whatsoever. With the PHAs, what I find is they're very, very, very biocompatible, which makes it so there is no immune response to them. They don't create any sort of inflammation, and hence they are a wonderful source of a polymer to create this cardiac patch. We've also looked at drug delivery in the context of cardiac tissue engineering with PHAs. So if we want to deliver a growth factor, which will enhance the scar tissue replacement, we've tried that, and it looks very, very promising. So these are the two major things. The third thing perhaps I should mention is also what is called a multi-material patch. So not only PHAs, we've added then alginate, which has encapsulated the cells, and then we create this multi-material patch that can be used to repair the scar tissue. So these are the things that I talk about in my presentation.